presided over the opening ceremony. He had managed to organize ICS and scientific meetings 4 or 5 times a year during his presidency. He also provided surgical case demonstration and surgical volunteer teams for surgeons and patients in several provincial hospitals across the country. He also led the Surgeons for All team of the ICS Thailand section to provide scientific conferences and surgical case demonstrations for surgeons and surgical treatment for patients in neighboring countries such as Cambodia, Thailand. On many occasions, when the ICS Thailand section was faced with financial trouble, Professor Singpore successfully sought donations and contributions from many organizations, pharmaceutical industries, and other private enterprises to save the ICS Thailand section from financial loss. So thank you very much to Professor Singpore. Served as the first female world president of the International College of Surgeons in the 90-year history of the ICS. Professor Kwan has enhanced the legacy of International College of Surgeons founder Dr. Mas Torek by continuing to lead humanitarian surgical missions to many countries around the world. I was honored to have her in Paraguay 2 times. In humanitarian mission. She has enhanced the role of women in global surgery. A practicing philanthropist, Professor Annie Kwan, has supported the International Museum of Surgical Science, a division of the International College of Surgeons, for the past 15 years, and continues to do so by supporting 2 Taiwan exhibits in the International Museum of Surgical Science. Of surgical oncology in Japan. He has a warm personality and has made notable achievements in the surgical field. Unfortunately, Professor Tamipillai said almost everything that I was going to say in the introduction of this session. But he explained it very well. Since he explained what our role now as global leaders is with the global surgery. We have an official relationship with the WHO. It was in 1980, the first time that this problem was addressed or stated in ICS Congress in Mexico in 1980. Since then to 2015, almost nothing has been done to address the problem of the unmet needs in surgical care. In 2015, there was the Lancet Committee published an article addressing that, and also in 2015, the World Health Organization passed a resolution, that is Resolution 2815, to address and stimulates to all member states to strengthen the surgical care in each country. And so we as the global leaders in the International College of Surgeons are advocated to accomplish these goals of the ICS aim. And not only to accomplish, but we are trying to be leaders of these initiatives. And what we want to present to you today is what we've been doing with respect to humanitarian surgery, the humanitarian missions in all our 6 federations. So I would like to invite the 6 representatives, Professor Kwan. The Africa Federation representative, Professor Essien. Excuse me, Professor Kwan. Africa's first. Huh? You can come and sit here and wait for you. Okay. So, as you know, we have 6 federations, and we are going to hear from each federation what they've been doing with respect to humanitarian surgery. Representing the African Federation is Professor Akanimo Essien. Professor.
Thank you. Thank you. So good morning once again. Sorry about the slide hitch. This was tested yesterday and it worked. I don't know why it worked. Luckily I had a backup. So I have no disclosures to make, and can I see that? Okay. Now that's who I am. I am a professor of urological surgery at the University of Canada, and that's the hospital where I work, University of Canada Teaching Hospital. So humanitarian surgery, definable as surgical care for those in need, often in resource-constrained settings. Envision surgery as being more than just the technical mastery of an art, and being grounded in humanity, humility, and moral clarity.
But the role model, sometimes you can see from the history, like our leader next door. But we cannot really have a relation with them. For me, my role model is really in my surrounding people, so I can really learn from them. So, like the first one is The first one is Dr. Steiner. When I was studying at the University of Virginia, I think his mind is always helping people in need. So, and also my mentor, in the middle is my mentor, is also give me a lot of opportunity to learn. And the one that in the ICS is Professor C. Professor C is, before me, is my senior. Why in Taiwan the ICS still can going very well? Because of the goal of the Professor C. Professor C, PhD neurosurgeon. So in Taiwan, mostly of the member in ICS is half of them is neurosurgeon because of him. And also this is Professor Sami, and also I learned a lot from him. he also organized a lot of workshops, and from all over the world. The residents who didn't need to pay to learn from them. And also Professor Takakura from Japan. And I think role model, sometimes we can study from the history, but sometimes I think it's better if the people is learning, you can learn more. And in 2011, I served as the Taiwan ICS president. From that time, I started to communicate with the World ICS body. And but unfortunately, during my presidency as the World ICS, the COVID pandemic, so I don't have this ceremony. So the ceremony is done by our honorary fellow, myself. And I think as a surgeon, we have a fantastic dream as surgeon. Yeah, I believe surgeons have more fantastic dream. And observation, creativity, this is very important. But the most important thing, I think, not just only observation and creativity, you need to do it. Not only stop in the thinking. So you need to do it. And also, we should be grateful to people who support us and guiding us. So from the beginning, I learned from the Professor who provided Muhammad and my professor, Professor Wang. And for the WHO, Professor Paul Hanuser and Max always guided me to go to the WHO meeting. So I know what's going on in the WHO. And on the other hand, our government also supports me. And I'd also like to use this opportunity to thank Dr. Professor Nova. During my presidency of the Taiwan ICS, he invited me and asked the mayor to give me the souvenir. And I'm still remember until now. And since I was the president of the Taiwan ICS, I started to organize a lot of meetings. The first one is in 2011, just a few months after I taken this position, I organized a meeting in the Macau. What I want to do is maybe Macau is a small community, but I think maybe I can invite them as one of the section in our World ICS, but unfortunately it's not success. And this is my first time to join the World Body meeting in the ICS because Taiwan has a difficulty because too many at the time people don't want to recognize Taiwan. And Taiwan was suspended in the ICS. But after I'm as the president, I'm traveling a lot, visit a lot of countries, and let us come back to ICS. So since that time, we always active in the World ICS. Because I think there's too many things. If I presented my talk, I think I cannot finish. So I decided to make a video. Okay, because they try to open the video now, before that I will continue. And this is just recently in October. Before in 11 years ago, I already established a museum in our museum, is a Taiwan room. And this time, this October, I organized one more time. It's a honorary fellow room from Taiwan ICS. The goal of the why we need to have a room in World ICS museum. I think it's one of things we can have our finance because the big problem in our world, ICS, is finance. So if we can help our world body to have some more income, I think it's also a good idea. So this is one. And the second one, I think for Taiwan, surgical, the surgeon from Taiwan is really have a good head. And also they do a lot of humanitarian. So to make more people to recognize, so I think I put the honorary fellow in the museum is also one of the way to introduce our Taiwan honorary fellow. Still, I think this is my last slide. I do a lot of things. So since I'm born in Indonesia, so I'm originally Indonesia. So I started to do the humanitarian surgery in 2012. It's starting from Indonesia. And also I'm working together with the local ICS with Professor Tahalele and Francis Alivi and Masmo from the Indonesian ICS, and also I invite the Poland ICS come together. So we work together. It's not only Asia Federation, Asia Pacific, and also European Federation. We work together for the first 5 years. We just only do the humanitarian service, and then in 2015 we are looking for. Because to do the surgery in a foreign country, you need to have legal authorities. So we starting to make the MOU with Air and also Indonesia. So after the MOU, we can do the surgery in Indonesia. So from 2015 to 2018, we do a lot of surgery in Indonesia, because Indonesia is an island of country. Even Surabaya, Jakarta, really, they have a good hospital. But in the small island, they don't have hospital. So that's why we go to the rural area to helping them. And after that, we're starting to work also with the medical team and with Dr. Parkhead, and also with the Mexican ICS and Guatemala ICS. So we always in progress. And maybe next year we will starting to have the third time of the Paraguayan mission, surgical mission. I'm sorry because the video is not working. So if you have any question, ask me at any time. Thank you very much.
All right, so I'm just going to tell you about the activities of the European Federation concerning humanitarian surgery. Okay, I have nothing to disclose concerning this speech. Now, we do have two programs. One is in Nigeria. We work in a district hospital in rural Nigeria. The catchment area is about 150,000 population. And the hospital has wards of surgery, internal medicine, modern child health care, TB, and OB2. There's usually 3 to 5 local doctors doing the national service. They spend 1 year in rotation. None of them has any specialist training. Now, prior to our program there, which started in 2011, they did an average of about 1 surgery per day. Now, this is the history. We've done 27 missions with training teams in the last 14 years. One mission takes about 2 weeks. 81 team members carried out 140 assignments. That is more than 2,000 days. And 7 experienced team leaders were leading these missions. Now, what did we do in 2024 and 2025 as a European Federation, and especially Swiss and Czech sections? Now, we started the first mission in 2024 in March with team of 6 people, midwives, surgeons, OB/GYN, and scrub nurse. These are the basics because we offer essential and emergency surgery in that district hospital. Now the focus of that mission was surgery, of course, gynecology and obstetrics, including the midwives. It was the first time that we had midwives in the team. So we could focus on mother and child health care, and they did multiple lectures and 128 surgeries. Now the next mission was a Czech team going down, and I'm very proud that this collaboration works. Thank you very much, Professor Novak. There were 5 people, surgeons, anesthetists, and again a scrub nurse, very important in these settings. We try and teach them hygiene, asepsis, to keep our infection rate low. And we will have a paper tomorrow elaborating a little bit more on our results of more than 3,000 surgeries done in the last years. So if you would like to attend, you're welcome. Now that dynamic all-women team trained the local staff in theory and practice again. They did the first workshop on non-operative fracture treatment, learning how to cast fractures. They did 78 surgeries during that time. In November, there was a team of 4, again with surgeon, anesthetist, midwife, and a junior surgeon. We do try to take along junior surgeons as much as possible and available to train them because we need to train our successors. And unfortunately, the training program for surgery in Switzerland does not prepare people for global surgery. So we like to do that during our missions. We had a teachers CPR training course lasting 2 days. We did 100 surgeries and lectures on different topics related to surgery and obstetrics and anesthesia. Another mission in January 25. Again, 6 people. Now this time there was a filmmaker on the team. That was the first time. There is in fact a 30-minute film. It's only in German available. We didn't translate it, but it is a 30-minute film about the project. You can view it and download it on YouTube. If you're interested, I can give you a link. That's all the film. Yeah, right. There was a wound specialist on the team with that, on that mission. So of course they concentrated not only on surgery and anesthesia, but also on treatment of chronic wounds and modern wound therapy. And the wound specialist trained the nurses, especially in dressing techniques and infection protection. Then in June, we were a small team, only 2 of us, 2 surgeons, and we had a mission in Abuja, the capital itself. We were a bit short on time because the idea was to do a short mission, surgical mission in Abuja, and then to attend the annual meeting of the Nigerian ICS section. So we still did with a small team 92 operations, including hernias, myomas, hysterectomy, pediatric hernias, hyperseals. We had some lectures and we implemented, because it was the first time we were spending at that small hospital outside of Abuja, we implemented the WHO surgical safety checklist with visible improvement on the process. As you heard, we participated in the annual meeting and scientific congress of ICS Nigeria. That was very good to make new friends, for networking. We could also present some of our data, outcome of 2,000 plus hernia repairs in this setting. And the last mission during these 2 last years was just concluded last week. I was there with a team of 4. And first time we had a professional trauma surgeon with us.
Okay, continuing with the humanitarian surgery and the thing that Peter Omar said, how we do the humanitarian surgery. We do this kind of surgery in Peru, Paraguay, Guatemala, and also in Argentina. We follow this thing to make our missions, preventive missions, by high quality.
And in Argentina, for example, we live in Buenos Aires. It's a very new city, open city, with all the facilities. But in other regions, like in northern Argentina, we have a lot of people who haven't any possibility to get to the surgery. So we moved there, and we moved in a non-governmental organization, and we used to be there twice a year, and we go around 100 people. We go there by plane, by bus. This is the region. You see the area. It's not the big airport. It's all by air. And this is the hospital. The hospital where we go is different. It's a big hospital, but there is only the external part of the hospital. In the internal part we go with the equipment of the laparoscopy. Also, we can take the C-arm and the hospital to make our surgeries. This is another campaign. In each campaign, we make almost 350 operations and 6,000 consults. In these missions, we go to these cities called Pompeya, Castel, Atenas, Monte Quemado. We made also 350 surgeries each campaign and almost 6,000 consultants in each campaign. It's a very large group, and we are trying to make the best operation in less time, so it's very interesting how to manage, how to deal, because we carry all the things that we need for the surgeries. The needles, the equipment, the C-arm, all things, and we operate with high security. We have less complications. This is the team. The team performs for almost 5 surgeons, 16 nurses who order how we manage the patients and who follow the patient after the surgeries, and they have no complications. With the possibility to operate the bladder, hernias, plastic surgery, eyes, ophthalmology, gynecology, pediatrics, dermatology, urology, we operate a lot of things. This is the place we are visiting, and also we teach a lot of things. And we have, if we have a large surgery, we call for and we carry the patient for other city, and we operate with the surgeons in this hospital that have residents, and also we teach them how to operate, for example, liver laparoscopy or retroperitoneal surgeries. Also other missions in Argentina and Santa Mendoza, and in the Paraguay mission conducted also by Dr. Ali Juan and the Minister of Health of the Republic of Paraguay. They made 2 missions, also with the Mexican peoples, and they worked together. It's a very nice experience, and we can work with all these manners. Also, we made laparoscopic surgery, eyes, GI surgery. This is the procedures, and these are the people who go to the international team, and we feel that it's a very good manner to serve our people in our countries. Okay, thanks very much.
I'm here in lieu of Dr. Dixon Santana, our North American Federation secretary, who could not be here at the last minute. He had asked me to present this report. I do not have any fancy slides to share with you. This is a brief summary of the last 2 years of the North American Federation. The North American Federation has 3 countries: Canada, Mexico, and USA. Number 1, Canada. This section has been dormant for several years. This is mainly due to transition in leadership at the local level, where the members have retired and recruiting new members has been difficult. In the most recent American College of Surgeons meeting, Dr. Santana had been reaching out to the local Canadian surgeons and has been looking into opening re-energizing the Canadian section, and there's some hope in doing so in the next couple of years. The Mexico section, he has been in contact with Dr. Ulysses Rodriguez. She had several discussions about collaborating between the sections. They're getting together sponsorship for meetings and regional activities to the community. The two major functions that the Mexican section held, one was a joint session with the ICS Mexico, with the Mexican Academy of Surgeons.
And also Professor Mariawan, now is the current section president of the Indonesian sections. And of course, Professor Aileen Wan, because everything we did, most of the things that we did started from her. So these things are showing that collaborations between sections are very important, and not doing it by yourself. You get more resources, you get more sustainability, rather than putting one section as the only section who is doing the mission.
It's still a problem, so we don't have the solution for that yet. But of course, telemedicine, after the mission, we give our consultant numbers, and for several months, and up to last month, I still have a consultation from the area that we perform surgery, local surgeons who are doing the surgery. They ask, how do you do this case? How would you manage this kind of case? And it's still ongoing now. So I think that is all that I can present. Professor Parker, thank you very much for your time.